And one of the questions that was asked of me, maybe I'll jump ahead here a bit because it still is talking about our experience. How are we doing in our skilled nursing facilities? So I mentioned these 6 nursing homes, 392 of their residents have tested positive over the pandemic. They've had 163 of their employees that have tested positive as well. And we were very fortunate in that some of the early practices that we put in place with respect to our 2 skilled nursing facilities. We have a 54-bed unit over on Court Street, our South Campus, our long-term care facility, and then we have a 16-bed short-stay skilled nursing unit on our West Campus in the rehab hospital. Those 16 beds, they primarily take, again, care of patients that stay for a pretty short period of time, and they're also undergoing quite a bit of therapy, PT, OT, speech. We had not experienced any outbreak of the virus in either of those skilled nursing facilities, but unfortunately that changed last week, where we have had now 5 patients in that short stay unit on the West Campus have now tested positive, and we have 9 employees that work in that unit have tested positive as well. And this is one of the confounding things about this virus. And again, while we're learning more and more about it, there's still so much that is unknown. So these, we have patients, obviously that they're admitted into the acute care hospital. They may be admitted for a hip fracture or need a joint replacement, and that successfully occurs at Kaweah Delta, but they're not quite ready to be discharged home. So they would benefit from a period of stay in that skilled nursing unit on the West Campus receiving some of those therapies. So we had a patient on 3 South that was ready for discharge from the acute care medical center, and we were going to transfer out to that skilled nursing facility. We tested them for the virus just immediately before transferring them to there, and they tested negative for the presence of the virus. But after being transferred out there, within a few days, they started to exhibit symptoms. And then we tested them again, and they tested positive. And then that virus spread to other patients and staff in that skilled nursing facility. So that's been one of the real frustrating aspects of it. And that's where some of our employee outbreaks have occurred in the hospital, is where a patient does in fact test positive and shows no symptoms whatsoever. And so we don't necessarily exercise the same precautions that we do with a known positive COVID patient. We still wear masks, but we're not wearing an N95 mask, and we're not worried about an aerosolizing procedure or putting them in a negative pressure room or an isolation room. But there are patients that appear that they are in fact positive, but they don't have enough of the virus in their bloodstream to be detected by the molecular test, which is hypersensitive. It can test very minute levels of the virus, but the virus is there, but it's not yet testing positive. And so it's during that period, between them where they don't test positive and then all of a sudden they have symptoms, that's our period of risk, where we can still catch the infection, but it comes as a surprise. So again, that's causing us to just rethink how we approach all patients, and do we get to the point that any patient that's admitted to the hospital is treated as if they're COVID positive. And we just don't have enough isolation rooms. We've gone from 10 negative pressure rooms that we had at the beginning of this pandemic. We now have 86 that allows us to put a COVID positive patient in the room and not let any of the virus escape from that room. But we have 400 beds in the medical center, and we can't turn them all into negative pressure rooms and treat everyone as in isolation. So we're obviously continuing to learn throughout this practice.